advanced image analysis technique to examine the human body. It involves tools like X-ray, CT scan, MRI, ultrasound, and retinography. These images help doctors screen for disease, make a correct diagnosis, and plan the best treatment for the patient. In simple terms, medical imaging allows us to see inside the body without surgery. So, in making the healthcare faster, safer, and more effective. X-rays are a type of electromagnetic radiation, just like visible light, but with much shorter wavelength and higher frequency. Because of this, they have enough energy to pass through the body, which is why they're useful for medical imaging and revealing structures like bones and organs. X-rays work by passing through the body and being absorbed differently by different tissue. Dense material like bones absorb more X-ray, so they appear white on the image. Soft tissue like muscle or organ absorb less and appear in shade of gray. Air-filled space like the lungs absorb the least and show up as a black. This difference creates a clear contrast on the film or digital detector. This will allow doctor to see what's happening inside the body without surgery. X-rays are essential tools in medicine, but they do come with safety concerns. They produce ionizing radiation, which can slightly increase the risk of cancer, especially in children and pregnant women. That's why doctors may suggest safer options like ultrasound or MRI during pregnancy. To reduce this exposure, radiographers use lead aprons and adjust settings to keep doses as low as possible. X-ray will help diagnose conditions like fracture, pneumonia, and certain cancer. They are also used to plan treatment and for routine screening like lung cancer. Beyond in the healthcare, X-rays are used in industry to inspect equipment and detect hidden objects. Before an X-ray, remember to inform your doctor if you're pregnant. Remove any metal items and follow all instructions. If you're concerned, don't hesitate to ask about other imaging options.
What is ultrasound? Ultrasound is a type of sound wave. Human ears can normally hear sound between 20 Hz to 20 kHz. If the frequency is lower than 20 Hz, we call it infrasound. If it's higher than 20 kHz, it's called ultrasound. And we cannot hear it. Even though we cannot hear ultrasound, it is still a sound wave, just like the sound we do hear. How do ultrasound wave reflect? Ultrasound imaging works using the idea of echolocation, just like how bat or radar find objects. A sound pulse is sent into the body, and when it hits a structure like an organ or tissue, some of the wave reflect back. The machine detects the reflex wave and measure how long it takes to return. This is how we get an image of what ultrasound works based on the few important physics concepts. First is reflection. When the ultrasound wave hits a boundary between two materials with different acoustic properties, part of the wave reflects back. This is how ultrasound images are formed. Next is refraction. As the wave passes from one medium to another, it bends because the speed of wave changes. This bending can affect the direction of the wave. Then, there is frequency, which is the number of vibrations per second. Ultrasound uses high frequency waves above 20,000 Hz, which are higher than what human can hear. Lastly, we have wavelength, which is the distance between two wave crash. It is inversely proportional to frequency, meaning that as frequency increases, the wavelength becomes shorter. Ultrasound has many important uses in the medical fields. Firstly, it is commonly used in pregnancy scan to check the growth and the health of the body inside the womb. Secondly, it is used for soft tissue imaging like checking muscles, veins, or organs. This helps doctors to detect the problem without surgery. Lastly, it is used for heart echo, also called echocardiography, to see the heart chambers, valve, and how the heart is pumping. Ultrasound is safe, fast, and doesn't use any harmful
X-ray
radiation.
imaging play a major role in saving life, especially in emergencies. In car crashes or fall, X-ray give doctor a quick view of broken bone, collapsed lung, or internal bleeding. This help them act fast and in many cases save life when every second matters. It is also powerful in the earlier detection of cancer. For example, mammograms special X-ray of the breast can spot sign of X-ray breast cancer even before alarm is filed. This means treatment can begin earlier, making recovery more successful. X-ray also helps surgeons work with great accuracy during bone surgery. Real-time X-ray image act like a life guide, helping doctor place screw, place or implant exactly where they need. And let's not forget dentists. Almost every dental visit involve an X-ray. It helps spot cavity, check wisdom teeth, and plan treatments with more precision and care. Ultrasound imaging also has a huge impact, especially because it's safe and doesn't use radiation. It's widely used in pregnancy to let parents see their baby's heartbeat and grow inside the womb. This brings peace of mind and happiness to family. But ultrasound does more than that. It reveals what's happening inside the body without surgery or pain. Whether it's checking kidney stone, the liver, or the gallbladder, it gives clear answer quickly and safely. Ultrasound can also protect the heart and brain. With Doppler ultrasound, doctor can track blood flow in real time. This helps them find clues or wave problem early, sometime before any symptom appear. And just like X-ray, ultrasound helps doctor during treatment. It guides needle during biopsy or injection, like a live camera inside the body. This makes procedures safer, smoother, and more accurate. In conclusion, X-ray and ultrasound are two of the most important tools in healthcare today. X-ray help doctors see bone and chest problem, while ultrasound are safe for looking at organ and during pregnancy. They help find disease early, guide treatment, and save life without needing surgery. Thanks to medical imaging, patients get faster, safer, and better care over the world.